Evaluation and management is probably one of the toughest sections in the CPC exam. Now, the good news is in the exam platform, they embed an E&M calculator. So if you know how to use that, that can definitely save your butt on exam day. In today's video, I'm going to go through a few examples of how to use this evaluation and management calculator, where you can find it so that you can start practicing in preparation for your exam, and it will make those cases so much easier to go through. Hey there, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. So let's get into some E&M practice using the AAPC's calculator. Now, I will link below where you can find the E&M calculator. It's at aapc.com/code/EM-calculator. You could also find it on the AAPC website by going to Software and Services, and then it's under the Calculators and Tools section. So here is the E&M calculator. The first thing it's going to ask you is your date of service. So I'm just going to put in yesterday's date because it won't let me select today's date. And then it's going to start asking you things like the type of service. Now, depending on what kind of evaluation and management service it is, it's going to give you different prompts. So for my first example, we're going to work through a case that is an office visit. When we look at the options that we have to select from here, we can see that this is an outpatient established office visit. If we look at all these code descriptions, they're all outpatient office visit. So that will help us get some clues as we're even working through the calculator. But in order to code this, we have to read through the note and pick out all of the pieces that will calculate into that medical decision-making and all those different factors of the evaluation and management service in order to code it correctly. Now, since again, I'm not working in an active exam platform, this is just kind of a pretend one that I put together. I'm not going to be able to show you exactly what it looks like in the exam platform, but this is some mock scenarios that I made up. Again, I am not a clinician, so I apologize if there's anything in here that is clinically inaccurate, but we're going to kind of look at it for what it is right now. So the type of service that we're looking at, we can see here that this is likely an outpatient office visit. So we're going to select that type of service. There's multiple different types of service that you have to select from here. So there's consultation, office outpatient, inpatient or observation, emergency department, home or residence services, nursing facility, post-op visit, prolonged services, telemedicine services, case management, advanced care planning, care plan oversight, counseling risk factor reduction, critical care, newborn care, non-face-to-face E&M services, preventative medicine services, special evaluation and management services, and transitional care. So again, depending on what type of service you're selecting here, it's going to give you different prompts. But the one we're looking for is the office outpatient, and now it's going to say the type of visit. Is this a new patient or established patient? Well, it doesn't tell us in this scenario if it is a new or established patient, but it does say that they're returning for follow-up. So if they're returning for follow-up, that likely means that they are an established patient. They're coming here again. They're not a new patient. So we're going to select our established patient. The second indicator that we had that this was an established patient is that all of the options that we had were established. Maybe they're going to throw you for a loop though in the exam and have some that are the same level, and one might be new and one might be established. So you're going to have to look for those key indicators here, like this is a patient that's returning for follow-up, or look for a term that says maybe patient is new to us or was referred by another provider and that they're being seen for a consultation. You're going to have to look for those keywords. So there's a little box here that says, was this an encounter that fits the description of an office or other outpatient visit that does not require the presence of a physician or other qualified healthcare provider and therefore cannot be measured by time or medical decision making? This is the key thing though, such as a nurse visit. So basically what it's asking you is this like maybe a 99211? So something like a patient's just coming in for a weight check or a blood pressure check, and they didn't actually see the physician. So this was not the case for this scenario, so we're not going to select this visit. For some reason, it often goes to this final code level, so I'm going to go back to the medical decision making because that's what we're going to calculate here. If we look for time, we can do that. Check and just brief. Oftentimes, we'll put it down here at the very bottom. Look to see if there's any kind of time in there, because if there's time, we can just code it based off of time. We don't have to worry too much about the medical decision making, and that will save us some exam time, is what it'll do. So let's say we're in here and we're in our medical decision making. Now we need to go through all of the different components of medical decision making to get that level of service. So in this case, the patient had hypertension, they had type 2 diabetes. So I know at very minimum, this is going to meet our requirement for 2 or more stable chronic illnesses. Now, because I'm a little more familiar with evaluation and management than someone who's maybe just coming into this, would probably just stop there and go, okay, is there anything I know from this section that would make it a higher level in here? But you can certainly go through and click as many of these boxes as you want. It will still calculate the correct level, even if there is one certain section that made the high level higher or lower. It's gonna factor in all of that. So in this case, for the component, because we have 3 different components here of medical decision making, the number and complexity of problems addressed, the amount of complexity of data to be reviewed and analyzed, and then the risk of complications of morbidity or mortality. So you have to fill out all 3 of these sections in order to get that right level. So I'm looking at these 2 or more stable chronic illnesses. If we have anything higher than that, do we have one undiagnosed new problem? No, we don't really have an acute illness with a systemic symptom, no acute complicated injury. There was no chronic illness with a severe exacerbation. And when you're looking at those exacerbations, look out for that word severe, because that's a very key word that can change a level 4 to a level 5. And one acute chronic illness that poses a threat to life or bodily function, we really don't have any of those. We might have some of these lesser ones. We definitely have probably one stable chronic illnesses. Let's move on, though, to our amount and our complexity of data to be reviewed and analyzed. So next, did we review any prior notes? Did we review any tests, order any tests? Did we review or analyze assessment requiring an independent historian, independent interpretation of a test, discussion or management of the test with an external physician? So this was a pretty straightforward case. I'm not seeing here. They have their at-home BP readings. They have vitals. They do have a lab. They reviewed their A1C. And then we have hypertension, maintain lisinopril, consider something, but it doesn't look like they really ordered anything. They said to repeat the labs in 3 months, but I don't really see an order for the labs. So we're just going to keep that where it is. It doesn't look like we had any discussions with anyone else. We'll just move on to our risk of complications. So where do we fall under this risk of complications? We have our minimal, low, moderate, and high. So it doesn't look like we have anything minimal, gargle, elastic bandages. We didn't do minor surgery, physical therapy, occupational therapy, low risk testing, decision regarding minor surgery. We do have some prescription drug management. Now, there is a little bit of controversy or different thought processes as far as prescription drug management. My Medicare contractor has said that if they are stating that they're going to maintain them on the medication, that still counts as prescription drug management. There are some people who are very adamant that they need to change the prescription or consider other prescriptions, or basically indicate that there may or may not be some sort of change in order for it to count as prescription drug management. Me personally, if I see that they are maintaining their current prescription drugs, I count it as prescription drug management. You're welcome to argue with me on that. I'm not that heavily invested. So that's where I would count that. And that brings us to the end here. So now we're going to say here, it says the final level of medical decision making is moderate. We're going to save, and it's going to bring us to our final code level. So it says down here, after it calculated everything out, 99214, which is great. If you're someone who is doing this for auditing purposes, you can also download the entire PDF, so that it is a kind of cool calculator in that fashion. To reset it, you hit the Start New Code Calculator. Now, I will go through one where we do some time. So we're to go through time-based coding, so you can calculate based off of time, but there's also a section here for critical care services as well. And then, of course, going back to our sample, this one would be selected as a 99214. Now, in our next case, This patient is on hospital day 3. Be careful when you see the word hospital. That doesn't always necessarily mean it is a hospital visit. Sometimes it'll say this patient was discharged from the hospital 3 days ago, but now they're actually being seen for transitional care. So just because it says hospital doesn't necessarily mean it's a hospital visit. Sometimes they like to get really, really tricky with that. So this says the patient is on hospital day 3 post acute ischemic stroke. And they have a mild headache, they have some left side weakness, slight improvements, they don't have any new symptoms, vitals are stable, they have an improving stroke, they have hypertension, and they're continuing with their current therapy. So we have a couple of different options here. We have the 99232, 99233, 99238, and 99283. So these two are subsequent hospital visits. This one is a discharge. And this one is an emergency department. So it looks like it's not going to be this one because this is an emergency department visit. And this patient is no longer in the emergency department. They might have come in through the emergency department. And sometimes they'll put that in there too, just to try and trip you up. But currently it looks like this patient is in a hospital bed on a subsequent hospital visit. So not a discharge, so not the 99238 either. So let's get into our calculator. So we're going to hit our date of service, and then we're going to hit our type of service. So in this one, it is an inpatient hospital or observation care. And we need to know, is it at the initial, so the admit? Is it subsequent? Are they being admitted and discharged on the same day, or is it a discharge care service? So they're not being discharged today. So it's not the discharge, it's not the same day admit discharge, it's not the first day, the time that we're being admitted or being seen the first time from this physician. This is a subsequent visit. So we're going to save that. And then we're going to calculate our medical decision making. We have the one stable chronic illness for the hypertension. Now we do also have the acute ischemic stroke. It's not currently active, but it is improving. And it says that they have some lingering left-sided weakness, but there is some slight improvement. And I believe also the headaches, I think it looked like mild headache. So it looks like there is some complications or residual effects. So I don't know that I would consider this acute uncomplicated, but I would maybe consider it more systemic symptoms. And not everything's going to be completely a one-to-one match or an exact fit. But I would say that's probably the closest to where I would consider that complexity level. Some people might even go to say, hey, it's a stroke, so it's going to be definitely a threat to life or bodily function. But I think since they are improving, I'm not sure that I can justify that it is currently a threat to life or bodily function, but still I would consider it at least acute diagnosis with some systemic symptoms. This is where it gets a little dicey because, we have here that it says physical therapy notes steady but slow progress. I don't know if that means that they reviewed the notes or they talked to physical therapy. So it's kind of hard to consider something there. But let's say for argument's sake, we're going to count that as a review of external notes. And I think for this one, it might not make a impact on the level of medical decision making. But if you're ever looking at some of these definitions and you're not quite sure about things like that complexity of medical problems, also remember that you do have definitions in your book. So whether you have the paper book or the ebook, you can go in here and double check the definitions in here, like what is a self-limited or minor problem, or what is an acute uncomplicated illness or injury. We also show here that we reviewed some labs, and then the patient is on statins. So we'll go down to our prescription drug management. And I don't think there's anything that would qualify it as high. We're not considering surgery. We're not escalating the level of hospital care. We're not de-escalating care because of a poor prognosis. We don't have controlled substances or other high-risk testing or treatment. So we're going to save that. And it will come down to our calculated level of a 99232. So that would be our option for this one. Now, I'm going to go over just one other case because I do want to go over a timed visit. So if we look at this visit, and I know it is a little small probably on your screen, but if we go down and kind of scan through this visit, we can see here that it says total discharge time of 35 minutes was spent, da 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 da. And it says here that this is a discharge summary. So let's go back into our calculator and we're going to look for a discharge or inpatient hospital, and then discharge care. And then we're going to go into our next prompt. And you can see that this prompt has changed based off of our prior selections. Now it's saying, oh, discharge care services are just time-based. So now it's going to ask us the appropriate prompts for this. So does the documentation reveal the total time? Yes. Enter the total time in minutes, 35 of them. So we're going to hit submit. That's how many total time minutes it said. It's going to give us our total time visit of 99239. So when we go back here, it's going to be our 99239. So that makes those timed visits very easy because you just have to plug them in with the calculator and it pops out the code for you. So I hope this video helped you feel a little bit more confident, a little bit more comfortable for your exam day on how to use that evaluation and management calculator. Again, it's going to be embedded in your exam platform, so you can pop it up, you can expand it, you can make it smaller, and use that function and set it up however you want to on your exam day. If you want some more information on evaluation and management, I do have an entire playlist on the channel, or if you want even more, you can go to my website, contempocoding.com. And as a YouTube viewer, you can use code YouTube50 to get 50% off my evaluation and management course. I will see you guys in the next video. And until then, just keep on coding on.